You might be shocked when she stand up and say, that ain't no simple girl. Yes, she is. Because we don't have to judge each other by the color of our skin. That's not what makes us family. What makes us family, what makes us sister girls and related is our concepts of life. Dr. Berry is not only a medical doctor, she is a Christian woman. And she is the author of a monthly column in the Horizon magazine. Some of you may have read it, called Ask Dr. B. And so when you see that, you know who she is. I'm not going to take up much of her time, but she is someone who I know that can bring us some facts about African American health. Would you put your hands together and welcome to the podium, Dr. Jill Berry.
I thought she was going to say that you'd be surprised if she was talking about the height. Well, I'm very happy to be here. And I'm very excited to be helping to celebrate Black History Month. And I'd like to tell you about a couple of extraordinary people who helped to advance medicine in the United States. You see, prior to the Civil War in 1861, there were no designated hospitals or clinics for African American patients. And there certainly weren't any certified or licensed providers. And almost all medical care that was provided to the African Americans was provided by those designated people within the African American community to provide care. Moreover, the schools that were available to provide medication did not admit African American people. So begins healthcare in America. There were a few institutions in the North, mostly Yale, Harvard, and Pennsylvania, that did allow some African American medical students. But so most African Americans who received medical education had to go outside the country to get it. And so most of that was in Canada and in Europe. I'd first like to tell you about an extraordinary person by the name of James Durham. James Durham was born into slavery in 1757 in Philadelphia, Pennsylvania, and he was owned by several doctors. He was allowed to learn to read and write because he was thought to be gifted. And because he was around doctors, he learned and picked up on a lot of the And these physicians invited him to go to medical school at the University of Glasgow in Scotland. So he went and he studied, and he graduated with his MD in 1837. And upon getting his degree, he came back to the United States. He set up practice in New York City, and medical records document that he had a very successful practice. But he wasn't done there. He also opened a pharmacy and was the first ever African-American to operate a pharmacy. So you see, Dr. James McCune Smith was an extraordinary person. More and more African-Americans were getting their degrees. And so decades later, there was another extraordinary person I'd like to tell you about. And her name is Rebecca Lee Crum. She was documented as being the first African-American woman to earn a medical degree. She was raised by her aunt and spent much of her time caring for those in the community that were sick. And that's probably where Rebecca got her first inkling of taking care of people. She worked as a nurse for years. You see, she was allowed to work as a nurse because at that time there was no formal education in nursing. There were no nursing schools. It didn't require a certificate or any special registration. So she was allowed to work as a nurse. But she wanted to be a doctor. So she was finally admitted because she was recognized as being such an excellent caregiver. She was allowed to be admitted to the New England Female Medical College and became the first